How'd you find the office okay?
I did, yes, thank you.
So Alana, I just wanted to let you know before we get started, since it's your first time meeting with me, that anything that you and I say, discuss in this time together is completely confidential.
Okay.
With the exception of 2 occasions, if you indicate that you want to hurt yourself or anybody else, I will, need to talk to somebody else about that, just for your own safety.
Okay.
But other than that, everything that you say here is just between us, so you can feel free to speak freely. Okay?
Okay.
So tell me a little bit about yourself and what brings you in today.
Well, I am a licensed clinical social worker.
Okay.
I work at the hospital, mainly in palliative care. So it's something that I really like doing. I like working with the patients that are in the hospital, and I like working with the families a lot to help them through the grieving process. We also help families decide whether or not they want DNRs, so do not resuscitate orders for the doctors. And that usually happens if the patient's really old and life-saving efforts just really would make their passing a lot more difficult.
Right.
Because statistically, only about 5% of people who are resuscitated actually are actually come back. So that's what I do for work. I'm here because the board at the hospital decided that some of the things that I did weren't really up to standard for them, and they have temporarily suspended my license. So I'm still a social worker. I'm just not at the moment a licensed clinical social worker.
So when you say up to their standards, can you tell me a little bit more about that?
They think or thought that some of the things that I did involving the families of the patients were unethical. So from their point of view, I need to evaluate my boundaries, I need to evaluate my motives, maybe some of my biases, and kind of work through them with you for about 15 sessions. And then once that's completed, I'm guessing that you're going to give them a report or something, and they will decide whether or not to reinstate my license.
So when you had this experience, I guess, where you called into your supervisor's office and they explained this to you, what was that process like?
I was called into my supervisor's office, and my supervisor was there, and her supervisor was there, and they explained to me what they felt was inappropriate. I'm guessing that they received a call from one of the patient's families that they did not appreciate the hard work I was doing for them. And they said that it was inappropriate what I was doing, that I needed to evaluate several things, it was unethical, and because the hospital especially, and of course the social work profession goes by ethics a lot, that my license is temporarily suspended.
Well, it must have been a bit of a shock for you to have them tell you this when it sounds like you're putting forth a lot of hard work and that you're telling me how much you care for these clients and families. Was this a big surprise for you? How did you take this?
It was a big surprise because I have taken time away from my family to help these families. I have made several phone calls. I've helped with transportation. I feel like I have done above and beyond, given 110%, and it's just not appreciated. And so it comes kind of like as a blow.
Sure.
Because I felt like I was doing everything I possibly could to make sure that, one, the patient was cared for properly in the hospital, and that they kind of came to terms with what was going on, and also that the family not only came to terms with what was going on, but was kind of helped through the transition of losing their loved one back to living their life at home.
Well, what I hear you saying is that your work ethic is very strong and that your desire to really go above and beyond expectations to care for this family and the client. So it sounds like you're a very hard worker.
I'd like to think so, yeah.
And it sounds like you really enjoy being a social worker.
I do.
So I would imagine then that it's important for you to get your license reinstated based on what you're saying.
It is, because I cannot work in the palliative care department without being a licensed clinical social worker.
So it sounds like we're going to have about 15 sessions together.
Mm-hmm.
Do you have set goals in what you'd like to do in this time together? I know you're mandated. But
Right, I am mandated to be here, so I might be a little bit of a tough client. But I am open-minded, I am willing to evaluate my boundaries.
Great.
I'm willing to evaluate my motives and my biases if I have any. I think my only motive would really be that I want to help these people as much as possible. But I don't know, they might think that's a little bit too much. So I'm willing to work on those. I have been, like now that I'm here, I have been noticing that since I haven't been working, my motivation is down. I'm feeling more down about things in general, and my anxiety is up because if I'm out of work for a long period of time, then it's financially straining for the family.
Absolutely.
Because we're used to a certain set amount of income. And with kids and a husband, I mean, he works, but I don't know. I mean, we're used to a certain amount, and we want to kind of keep that lifestyle. I mean, I'm guessing, like, we're going to have to tighten the belt a little bit, but for a permanent thing, that's going to be a really big issue.
Absolutely.
And then being licensed compared to just being a social worker, that's a huge pay increase as well.
It is.
So, I mean, I could technically still work as a social worker without a license, but one, I have this open investigation or open case, I guess, with the board, and two, the pay is just, it's not what we need at this moment.
Well, it sounds like in addition to the professional stressor of having your license taken away, that a lot of your identity might be wrapped up in this as well too.
Right.
And that feeling of just such sudden change in this and that uncertainty that comes with it, along with the financial implications of this.
Right.
That would make sense that you're feeling a bit down and that your anxiety levels have increased.
Yeah.
Now, have you experienced feelings of being down or high anxiety in other points in your life, or is this sort of a new thing for you?
I'd say off and on. I mean, everybody goes through, like, every once in a while they feel down and out, but I've always been able to kind of just work through it.
Okay.
Working itself is something that has always helped me because my identity is very much in what I do for others. So that's where I'm kind of lost at the moment because I'm used to work pulling me out of it if there's something like going wrong at home or maybe just not having a good day. But without work, I'm kind of at a loss as to, well, what do I do now?
So it sounds like you get a great sense of satisfaction from the work that you do, and feeling that even if you've kind of had a tough day, that the work that you're doing is positive. So have you tried anything else in the past that gives you that sense of fulfillment that work sounds like it does?
I have volunteered in the past. I haven't had time to volunteer in a long time.
Is that something you think you might be able to have time for while you're working to have the license reinstated, or are there other barriers to that?
It could. I don't know. Some places require like a lot of training to volunteer for them. I mean, I don't want to I don't know if this is stuck up, but I don't want to volunteer in just like stock shelves. I mean, I like working with people, and I'm a people person. So if I wanted to volunteer, it'd be something that would be hands-on, working with people, doing what I do best. And I don't know, I mean, it's 15 weeks, but a lot of places, if they train you, they want a commitment for a long period of time.
Sure.
I'm not able to give that commitment because once I get my license back, I'm going to be working again.
So your ultimate goal is to be relicensed and to be working in the same capacity in palliative care. Okay, well that's great. Well, it sounds like you're highly motivated to get that license back,
Yes.
even though you are mandated to be here. And that it sounds like you're really open to examining your boundaries and your motivations for some of the way in which you're handling work.
Mm-hmm.
I think that's really positive to be open to that. So when you initially had this meeting with your supervisor, was this the first time that you had gotten any feedback like this, or had there been other occasions?
I mean, when you work with palliative care, you're pretty autonomous.
Mm-hmm.
So, like someone next to me telling me that maybe I'm not doing something right, it's not really there. The feedback's not really there. I try and talk to a couple social work friends about work specifically, maybe once a month, maybe a couple times a month, and nothing's really come up that has alarmed them. But like weekly supervision or something like that, I just don't have that anymore outside of school. I mean, I had that in school, but not anymore.
Right. And how long has it been since you've been you've earned your license?
Let's say about 2 years, I think.
About 2 years. Okay. So you're still new in the profession.
Mm-hmm.
So
well, I've been in the profession for about 4 years because it took me about 2 years to get my license.
Okay. But it is nice to have that supervision to be able to bounce ideas off of people and have your boundaries checked.
And I do miss that. I mean, when I was getting my license, I worked somewhere else with kids. And so I worked there because I could get my supervision while I was working there. Otherwise, you have to pay somebody, and it's just extra time out of my day. And I want to spend my free time as much as possible with my kids. But so then I came into palliative care because it was something that I got a little bit of exposure to in school and something I was curious about, but I ended up loving it.
Yeah, it sounds like it's something that you really enjoy doing, which is important.
Yeah.
So you mentioned, the stress, the financial stress of this change. You mentioned a husband and you mentioned children. What is home life like for you?
Home life's pretty good. I mean, it's not chaotic. We have a routine going. So, I mean, it's not something that I don't want to go home to.
Great. So when you're saying that you're just feeling down and feeling a little bit anxious, you feel as though your family is a support system that's positive for that, or does that begin to make it elevated?
It's positive. I think that if it was prolonged or if there was the sense that I was getting that I would not be able to get my license back, and I think it might make things a little tense at home, only because I would feel like I'm not pulling my weight.
Right. Okay. So it sounds like that's very important to you to contribute financially to the family.
Yeah.
And it sounds like you've got a lot of great positive things going on with, a husband and your kids and determination to get that license back. So these are all really good motivating factors for our work together.
Okay.
Do you have any questions for me about the process, or?
What kind of, I know when I was in school, we learned about all different types of modalities of therapy. And there were, of course, a few that I aligned with, but as a medical social worker, you kind of adapt to the patient, and you don't really use one set. Is there one set modality that you?
I don't work with just one set. Usually I try to use an integrative approach.
Okay.
So we'll see, as you and I work together and start working on, defining, your boundaries and what your goals are for the profession, and hopefully you can find a modality that works with that.
Okay.
Great. So what we can do is we can set up a future appointment and continue with that. Does that sound good to you?
Yeah.
Okay, good. And so for now, do you feel as though your anxiety and your feeling down are you feeling hopeful after thinking about this work together, or is that?
Not hopeful yet, but I did have some anxiety coming into the appointment, so that's a little bit reduced.
So on, say, a scale of 1 to 10, 10 being incredibly high anxiety, 1 being low, where do you find yourself on that scale?
Probably about a 7.
About a 7? Okay. What do you think it would take to get you down to a 6?
Probably just knowing that I'm continuing the next appointment and following through with going to the next appointment.
Okay, excellent. Well, we can definitely make an appointment for the future and get you on a regular date and time if that
Mhm.
works for you.
Yeah, that would be best.
And then you mentioned, having sort of a purpose and being able to work with people, and that volunteering might be something that would be beneficial for you. Is this something that you might want to look into, a little bit of a homework assignment perhaps between now and next week to see if there's any volunteer options?
I'll look.
Would be a good use of your time.
Mhm.
So,
Yeah, that'll get me away from thinking constantly about what's going on.
because it's definitely a big transition for you right now,
Right.
So it's good to be able to occupy your time positively.
Mhm.
Okay, well, do you have any other questions?
No, I'm okay.
Okay, excellent. Then we'll make an appointment